Good morning. As a part of my MPA from Kalaisalingam University, I have done a project work in the title Patient Care and its Relationship with Customer Trust. A study with reference to private medical colleges in Calicut district, Kerala, and myself, Dr. Shamnasiam, and register number 9223115087. And regarding the introduction of this study, it well explained the customer relationship in the business system, that means in the hospital system, and the patient care which received from the hospital. So in between, so many factors which will influence the trust as well as the treatment strategy. So studies in India shows high respect for doctors traditionally, but recent years have seen erosion of trust due to commercialization, high out-of-pocket expense, and perceived iniquities. Research from Indian hospital highlights the high waiting time, not acceptable provider behavior, and dirty communication and less billing transparency as the top factors which will influence the trust. While moving to the objectives of the study, to study the relationship between the patient care and trust towards the healthcare staff, to study the relationship between the patient care and its relationship between trust towards the hospital, to study the perception difference among the patients of the different age groups and the relationship between the trust towards the healthcare staff, to study the perception difference among the patients of different age groups and the relationship between trust towards the hospital, to study the perception difference among the genders and their relationship with the trust towards the healthcare staff, to study the perception difference among the genders and their relationship with trust towards the hospital. So these are the two variables. In independent variable, as we know, it will be the patient care, and dependent variable, trust towards the healthcare staff and trust towards the hospital. These are the literature review. Research methodology, descriptive and analytical research design, primary data, data collection from the structured questionnaire, secondary data, sources from peer-reviewed journals, healthcare management case studies, government health reports, and book of the patient care services. Sample size around 50 to 300, and data analysis tools, statistical analysis such as SPSS and Excel to identify the correlation and trends. So the result and discussion demographics, it explains the number of males, that is around 136 males and 154 females have entered in the data sheet. So the demographics around 136 male and 154 females. The age distribution 18 to 13 years, 31 to 40 years, 41 to 50 years, and 50 above. And overall, it shows this the male around 9, 26, 41, 60. Overall 136, female 28, 27, 56, 43, 154. So the graph explains the number of males in the participated in the study in various age groups. So this is a questionnaire which I have used for the conduct of the survey. So the 7 questions from regarding the patient care, and the result is stating that overall performance of the male and female varies in different age groups. And this is the trust towards the healthcare staff. These are the number of answers which I have received against these questions, and this is the graph showing the report, and this is the trust towards the hospital around up to 23 questions, that means 16 to 23 comes under the trust towards the hospital, and this is the graph explaining this. Concluding, Importance of the trust in the healthcare is very very important. So the treatment adherence and disclosure and communication is very much important and very much influenced the study. So the continuity of care, satisfaction and loyalty, and legitimacy is the one of the important factor. So while discussing the study findings, the overall study was concluded in a well defined and systematic manner. And male respondents aged 18 to 30 shows strong support for several questions, with a noticeable decline among those aged above 50. Female respondents demonstrated higher levels of trust towards the healthcare professionals compared to males. So, females also showed greater support and trust towards the hospital than their male counterparts. So, while moving to the Viva questions, which I have received from the university, what is the main research problem or issue of addressed in the project and why it is important? Especially, this is exactly what I told in the previous slides: treatment adherence, patient satisfaction, service utilization, and overall health outcomes. And the second question: which research design, data collection method, and analytical tool did you use and why? I used quantitative research design as a study focused on the measuring patient perception numerically. Data was collected through structured questionnaire survey administered to the participants across the different age groups of the and genders. And the next question: what are the key findings of your study and how can they be applied in the industry? The key findings in the study: male respondents, as I told in the earlier, 18 to 30 showed the highest support and trust. Female respondent demonstrated higher trust in the healthcare professionals. And while moving to the application in the industry, hospital can design targeted communication strategy. And next question: what theoretical concepts or model support your analytical conclusion? Then answer: the study is supported by the concept from the Subqualque model, which focus on the dimensions like reliability and assurance and empathy. What next question: what challenges did you face during your project and what did you learn from the overall research process? The answer: the main challenges I faced included limited response rates, time constraints during data collection, and difficulty in reaching older respondents. I addressed these by conducting repeated follow ups and simplifying the questionnaire to improve the participation. Thank you.